Hey guys, this is Dr. Greg with Medical Muscle. And I'm currently a psychiatry resident, and I'm getting to work with a lot of students. And we just got our new class of first year residents in psychiatry. And as a first year resident, I didn't realize that I had, quite a bit of say in who I thought was a good candidate and who, wasn't like really the best fit. And a lot of us had a lot of input into choosing the current class now. I gotta say the people that I wanted as a residents were the top picks and are now on our residency. So I want to share with you guys basically from this point of view now, like kind of making suggestions to my senior residents and attendings who I thought were really good. What makes a good applicant in a program? So I can talk about psychiatry, but I think this would probably go for all specialties. So one really big thing for a student is how helpful they are. Okay, so I'm in residency right now. I'm in medicine, so my time is super limited. I'm super busy. I don't have time to manage students. I wanna answer all their questions. I wanna help them through this whole process, but just being able to text them and say, hey, we're rounding now, it's just tough. To be a good student is to be proactive, okay? You're looking, you text the resident and say, hey, I'm gonna follow this patient today. Is that okay? Okay? Just without being told, just be like, hey, I'm gonna go see this patient. I've read up on them. Can I present this patient? It helps us like crazy, right? Because you're talking to the patient, you might be getting some little details that might have been missed through all the interview processes. Being proactive is very important as a student. Okay, you can always just request, hey, can I follow this patient? Can I present this patient? And then chart check them. It's really simple. Just chart check them and ask. Go and talk with the patient. Very helpful. Ask if you have any concerns, but be proactive, being like, hey, can I go see this patient? What I see is not a strength in a student is when they need the resident to tell them what to do through the whole shift, telling them to go see patients, telling them that we have rounds at this time. You just need to just be proactive and be like, hey, I'm just gonna hang down here. I'm gonna be ready for rounds, or I'm gonna go see this patient on my own. Is that okay? That blows us away, right? Because then it's helpful. Hey, you're gonna go see this patient. If you're gonna go see them, hey, could you ask them this? And they're like, of course, And chart checking, looking through the chart really heavily. See if you can find something that we're missing, okay? I try to cover as much as I can, but it's not impossible to miss something, right? So, maybe in 2015, they had that one surgery, or that one, they went to Costa Rica for a week, and maybe that's the reason why they're presenting now in 2025. I don't know, but maybe you can find some pearl, and it would be really helpful to the team. The attending would think you were badass. All the residents would think you were badass. Yeah, okay. All right. Now, the other thing, and I felt like this was really important for me. I felt like I feel like I did a really good job with this one thing that a lot of people didn't do. A lot of students didn't do. And I think it's maybe because I'm a little older. So this was important to me, is when I'm in a situation with residents or attendings and they're not super stressed out, right? And I felt like it was appropriate where I could ask questions. I've kind of made a little connection with them, especially people I've made a good connection with, right? Or they seem friendly. They seem like they like to chat. I would ask them more about what is it like to be a psychiatrist, or any specialty. I would ask certain specialties I was kind of interested in as a student. What is it like? Would you pick this again? What do you like about this specialty? What do you enjoy? What brings you joy in this specialty? You don't say it like that, but in a nuanced way. Do you enjoy what you do? Because if they look miserable and they're giving you an answer that sounds miserable, then maybe this is not the specialty that you want to do, okay? Like, if you're going into something and you're picking, like if you're going into a specialty, it's a permanent decision, right? Pretty much, like you're going this route. This is your one opportunity to make sure that this is what you want to do. So anything that you're slightly interested in, okay? If you're interested in surgery and internal medicine and psychiatry, hopefully you don't have more likes. It should be narrowed down to like 2 or 3. But if you can catch a resident or attending that's, personable and they have the time to talk, it's kind of a slow day and they're kind of in a chatty mood, ask those questions because you need that for yourself when you're picking something, okay? That's a big one. And I think the last point I can make for any student that's going into clinicals is start studying early. Know your facts. Know your stuff, okay? Because every so often, someone may pimp you, the attending, one of the residents. And if you know the answer, it'll blow us away, right? You want to know your stuff. You want to know your stuff. You want to know what's going on with the patient. You do want to know your book stuff. Clinical skills are very important too. Don't get me wrong. That's just as important or more important, right? Clinical skills are important. But knowing your book stuff, knowing your book smarts, knowing like weird things about presentations is very key, okay? It makes you a more helpful student if you can figure out something weird that's going on with the patient. Because you're covering all this stuff. You're having to study it. So it's important. And then for yourself as a student, look things up on your own. If you have a question and you're thinking about maybe asking the resident and the resident's sitting there stressed out and they're busy and they're trying to get notes done or whatever, they're trying to see patients or whatever, that might not be the right person to ask a question, right? So a better way to do it is to go to UpToDate and ask that question there, okay? Ask that question, how to treat hypertension or what is the protocol for diuretics? Like when you choose which, right? When, in what situation? Or antibiotics, right? Choosing antibiotics for UTIs. Look it up yourself. It's gonna come up on your exams. I guarantee it. Maybe not all of it, but it will come up. Some of this stuff will. It also helps you with your retention because once you learn it really well and you study it and answered a question that you really wanted to know, you're not gonna forget it, okay? I still remember things from medical school that I looked up on my own and it stuck with me, okay? So, guys, I wish you the best of luck in this process. It's a great experience and I think you're gonna do just well. Just fine, okay? I'm lacking sleep, so I'm a little tired. All right, guys, wish you the best.